Hey friends, Dr. Mark here. A question of logic for my professional colleagues and the public at large. If it is possible for a bone in the spine to misalign, to be out of normal position, if that is possible, and by this bone being out of normal position, and we've now changed the structure of the human body in some way, which now makes that area more unstable and puts pressure on nerve tissue in some way, changing the structure of nerve tissue. If this is possible, which now interferes with the function of said nerve tissue, conducting life impulses from the brain to the body back to the brain, that this structure can no longer do the job that it was created to do at 100%, logically, this is always a bad thing. And if it is possible that somehow this limited structure, this limited matter of the human body can have these structural changes in a negative way, how are they caused? Can they be caused when these external forces overcome the internal adaptive forces of this principle that resides within the human body? And this principle being an innate or inborn law that simply coordinates and controls and maintains all structural function of matter in harmonious balance. If this is altered, that logically would always be a bad thing, because now your body, the matter, can no longer function to its full potential in the way that it was created. Therefore, if this vertebrae being misaligned, producing interference to nerve tissue in any capacity, changing the structure, therefore changing the function, therefore changing the physiological ability of life to be expressed, that would always be a bad thing and would require the necessity of somehow figuring out what the innate law is trying to do in regards to the specific structural matter that is deviated from its innate normal position. That adjustment would be necessary, and that having an adjustment, restoring this vertebral subluxation back to its innate normal position, allowing for a fuller expression of life, of innate impulses, would always be a good thing.